My name is Dr. Amrita, and here are some tips which I wanted to give you when you are discharging the patient from hospital to home. Point number one, hygiene and personal care. Hygiene and personal care are very important for the patient especially when they are on bed. So you need to take care of hair care, skin care, oral care. If you are not taking care of the patient or someone else is taking care, make sure that she knows these steps. Medication management is the second point, where when the doctor suggests you while discharging the patient to give the medications in this order, make sure that you should explain the caretaker, no matter if she is nurse, a caretaker, no matter her experience, no matter how she knows, it's your duty. You need to explain her well and make sure that you have to write it in your own handwriting and explain her this is the morning and this is afternoon and this is night. Third point is the nutrition and meal planning. When you are discharging the patient, make sure that you meet the nutritionist and get her the note, the restrictions on the diet and significant changes in the diet, and what is the balanced diet you need to give to your patient. Same thing you need to explain to the patient and the caretaker who is taking care of your patient, because the balanced nutrition is very important and she has to understand the restrictions on the diet and the water. Fourth point is mobility and exercise. All of you know mobility and exercises are very important when the patient is on bed, because patient is not moving at all. Unless and until you get the physiotherapist, make sure that you are doing a small exercises like moving the hands, moving the legs, turning the patient from right to left. This will prevent the bed sore and stiffness of the muscles and bones. Fifth point is wound care. Wound care is again important. Make sure that if it is a surgical wound, it has to be dressed up by the doctor or a nurse. And make sure that the caretaker should understand the dressing change, cleaning, and understanding the signs of infection at the wound site. It's very important and crucial part again to prevent the infections for the patient. Point is preventing falls and accident. If you are putting the patient on the normal bed, there are many chances of falling down from the bed to of course you know, all of you know that. So better you take a medical cot which has a side rails. I'm not giving you advice to buy some expensive medical cot. The normal cots which is affordable price with a side rails, if you buy that, you can prevent some medical accidents. Communication skills. Communications is again important because the patient is on the bed, had surgery, had stroke. The patient is with dementia or Parkinsonism. They need someone to speak with them. If they are not understanding, they are not listening, it's your duty. You should make them to understand. You should treat them as a kid. Point is emergency preparation. You should be ready with any emergencies when you have a patient at home. Even the caretaker must know CPR. We usually train our caretaker to know all the CPR techniques. The caretaker should know the CPR, then keep one first aid kit ready every time at home. It's very important, and take care of the patient with the signs of any medical emergencies. But not least, self-care for the caregivers. Caregivers are working for 24 hours for you, for your parents. Please respect them and help them to understand the patient situation, and you also understand her situation, at least her sleep, her food, her infection part. If you provide her gloves and take care of her, she'll definitely take care of your parent. Thank you so much.